Hello, good morning, Prudential. How are you feeling today?
Good, very good, excellent, oh yes.
So, before I proceed, maybe this is new for our guests. Usually in Prudential, we will always say good morning no matter what. No matter it's night, no matter it's daytime, it's evening. We will always say good morning. Okay? So our response also will always be the same. How was the response just now?
Good, very good, excellent, oh yes.
And in the end, we're gonna say apa kabar semua, and our response will be
Baik, sangat baik, amat baik, oh yes.
And in Chinese, we say
大家早上好。
好，很好，非常好，oh yes.
okay. I don't know how to speak Mandarin, but I have a translator behind there. Okay. So everyone, please have a seat. We are starting now. Please pick your seat and make sure the chair that you sit on has this goodie bag. Okay. Alright. No one wants to say Okay. So, welcome to UVE. So, who's new over here? Raise your hand. Okay. Who's been here before? One time? Few times? Okay, let's give a round of applause to our new guests. Okay, let's welcome them. Thank you for being here, everyone, for spending your Saturday morning with us for this collaborative event with Sunway Medical Team. They are at the back. And then, do I look nervous? No. Okay. And then, we are gonna have a game before we start. Everyone, please take out your phone. Ambil phone. So, does your app has a camera, or does your phone has an app to scan this QR? If no, then you can go to kahoot.com and you can put on this pin. Everyone doing okay? Can you guys scan? Okay, for those who have just arrived, you can have your seat here. In front here is empty. We have 4 empty seats in front. Okay, for those who have just arrived, please take your seat. We have 4 empty seats in front. Okay, siapa belum masuk lagi? Siapa sudah masuk, raise your hand. Sudah. Siapa belum masuk? Anyone? Still? Alright, we're gonna start in 5, 4, 3, 2, 1. Okay. Okay, so for the first question, this is our speaker of the day. Who is the speaker today? I just said it. Ini kalau ada orang dapat salah, nanti saya ya. Who got it wrong? The name baru pop up before. Okay, so let's go to the next question. Let's see. KK, who's KK? Crystal Ho, who's SBS? Who's SBS?
Secret.
Oh, Sharon. Who's Willie? Raise your hand, Willie. Oh, okay. Alright, let's go to the next one. Dr. Christopher Lee specializes in could it be minimally invasive surgery? So which one is correct? So all correct. Okay, we ask first Dr. Christopher Lee. Do you think this is correct?
Yeah.
All correct. Okay. You got the green light. Everyone correct. Okay, move next. But let's see who's the fastest. Wow. The Sunway team. Okay, privilege there. Okay, let's go to the third question. Prostate cancer only affects men. True or false or half correct? No answer, huh? Not sure, huh? Who got that false? Congratulations for those who get the wrong answer, because you are here today and you are about to learn a new thing. Okay, let's see who's the fastest. Whoa, still the same, the Sunway team. Wow, come on, Yuri. Come on. Okay, let's go to the fourth question. Prostate cancer is one of the uncommon cancers in men. Who wants to know the answer can directly ask. 4, 3, 2, 1. False. Anyone got true? Yeah. Then again, we are here to learn today, so no matter what is your answer, we're gonna recorrect that. Okay, let's go to the next. Alright, so fast. Okay. Let's go moving on. Fifth question. It causes symptoms in its early stages. One. False. So no symptoms, doctor?
The answer come out later.
The answer come out later. So please wait up.
Okay.
Okay. Looks like Ryan is still top number 1. Okay. Marker. Eating a healthy diet may help to lower the risk of prostate cancer. I think half true left. Kidding. So those who are new to this Kahoot game, in order for you to win, even though you get the correct answer, but you have to be the fastest. Yeah, so that's the trick. So even though if you know the answer, your hand must be quick. Okay, let's see who's the top. So we have KK. It's number 1, okay? And Zach, who is Zach? Oh, Isaac. Wow. Top 5, everybody is in here. Okay, let's go to the next question. A PSA test is used to detect prostate cancer. For those who are not sure what is BSA, later during the Q&A session, you may ask doctor, okay?
Okay.
Alright, let's see. Oh, still the same, keep it up everyone, okay? Those who get the correct answer but still at the bottom, please pick fast, okay? Where is the prostate gland located?
In the brain. Below the chest.
I think in the food.
In the brain.
Okay. Oi, in the chest, someone put that. Who put that? Can you hold your chest? Can you feel or not? Okay, let's go to the next question. Okay, still the same. Maintain. Okay, keep it up. Let's go to the next question. Which age group is most at risk for prostate cancer? Could it be children?
Woman.
Could it be woman? Because I think everyone here is very unique. In the chest, man over 50. Alright, so let's go to the next question. Wow, aloha. Aloha is climbing up. Let's go to the next question. Let's go to the third question. This is the third last question. Which of the following is a common screening test? So those who have the privilege to have a free screening later on, don't forget, yeah? Okay, BSA. Actually, the answer is in the previous few questions. Huh? Yeah. So next. So 9.2, only different with 200. Okay, Ryan, you can do this. Let's go next. Which factor can increase the risk of prostate cancer? Smoking. I think it's all of the above. It's correct and obvious one, huh? Because everything is affected and it's like a chain to each other. Okay, let's go to the next question. Let's see. Wow, Aloha and Morka. Who's Aloha and Morka? Are we in Hawaii? Okay, let's go to the last question. What is one possible treatment for prostate cancer? I think it's wear a jacket lah. For those who answered in the chest, I think you should cover it with a jacket. Okay. Someone answered drink more water. Okay. Congratulations. Radiation therapy. Let's see who's the winner. Oh, leader Adrian. Ryan. Who is this? Kate. Let's invite Kate. You sure or not? You don't know the answer. You didn't help? So congratulations, KK. You're gonna get your first prize later on. And then, how come you know the answer? Guess what? Not because you have the knowledge and experience. Okay, thank you, KK. So, everyone who is in the top 3 or those who are not in the top 3, this time and later on we're gonna escalate our knowledge about what we did not know and what we got wrong in the answer. Oh yeah. KK. We're gonna invite doctor to give this prize to KK.
Since you're so smart, you go home already.
Since she's so smart, she can go home already.
Photo here. 1, 2, 3. Okay.
Alright, thank you everyone. Once again, today is a very special day for us because we have a very special collaborative partner with us today to create this event with us in this morning. So thank you each and every one of you for making time with us in this morning instead of sleeping in the cold and rainy morning. You chose to be here. So pat yourself in the shoulder and say, you did great.
You did great.
Look your friend to the left, to the right, behind, and front. You did great.
You did great.
Okay. Without further ado, I invite the Sunway Medical team to. Okay. Let's welcome Sunway Medical team. Oh, okay. So there will be some technical to change the laptop lah. So what do you think of the game just now?
Good.
Okay, doctor, I ask you lah, since you're the specialist in this, what do you think of the question?
I think the answers are very good and the options are also very hilarious. I'm very sad that nobody chose wear a jacket.
Okay. See, I told you guys you should choose wear a jacket. For those who pick the one in the chest, you should choose wear a jacket. So I'm gonna ask, hi, are you? What's your name?
Terrence. Terrence. That's quite fun.
Do you think that you learned something new?
I also gained some new knowledge about myself.
Okay, thank you for your time here. Okay. So now the slide is ready. I'm gonna pass the floor to Sunway Medical team. Give a round of applause, please.
Hello, good morning everyone. So my name is Su from Sunway Medical Centre. So basically me and my colleague behind there, Amber, both of us are actually based in Beijing here. We are from the Beijing branch office. Okay. So before I pass the floor to Dr. Christopher, let me have a very quick introduction about our Sunway Medical Centre. Yeah? So Sunway Medical Centre actually established in November of 1999. So this year is our 26 years now, okay? And we actually is the largest private quaternary hospital in Malaysia. So the quaternary hospital actually is meaning that we actually, our hospital, we are offering a very niche of the service such as the transplant service, like kidney transplant, corneal transplant, all those okay? And you can see from this photo, actually is our hospital building outlooks. So currently we actually have total of 6 towers. Tower A, B, C, D, E, and F. Okay, so you can see for this tower D is the highest tower lah. Okay, so the tower D actually downstairs here we have a pediatrics A and E. So basically our hospital we have 2 A and E. One is for like general teenagers, and then the other one is for pediatrics for children. Okay. And also for the 15th floor and above, actually is our Sunway Century Hotel. So it's a kind of the service like provide some of the senior living, and we also do have a confinement center in the Sunway Century. And also for those like outstation patient or clients, like clients from Sabah Sarawak, they want to travel to somewhere, maybe for treatment, for consultation. So they also can stay in here. So we do offer some of the promotion rate for them also lah. Okay. And this is some of the snapshot of our hospital. So currently we do have 28 Center of Excellence, and total of 6 towers. We actually have more than 800 of the licensed bed lah. Actually we have ready around like more than 1,000 beds, but then because lack of the nurses, so we only can occupy 800 plus of the licensed bed currently lah. Okay, and also we have 18 of the operating theaters, and then A&Es, we do have 23 beds in the adults A&E and 10 beds in the kids A&E there lah. And this is our 28th Center of Excellence, like including the robotic surgery, women health, and also the cancer center and so on lah. Okay. And this is our cancer center team, our oncologists and hematologists. Okay, so we have quite a lot of the doctors from hematologist until oncologist doctor lah. Okay. And this is our doctors from breast and endocrine surgeon. So actually in Sunway we have 5 doctors here lah. And then one of the doctors, Dr. Teo, she is our breast and oncoplastic breast surgeon, which means that the doctor she actually can do the breast reconstructive things lah. Okay. And this is our gynecologist doctors. Okay. And also this is for the neurologist lah. And also definitely we have our Dr. Christopher here today. Okay. And this is our general surgeon and colorectal surgeon. Okay. So in some way, we actually believe that one machine cannot treat all types of the cancer. So actually we do invest quite a lot of different types of the machine for patient lah. Okay. So here is all our machine, like for the IRRT, is more targeted to the breast cancer. And then we also have the gamma knife, which is more targeted on the brain tumor, brain cancer. And also the true beam, PET-CT, and SPECT-CT, all these. So what's the difference for our PET-CT? So in Sunway, we actually have 2 units of the PET-CT scan machine. So one actually is the digital PET-CT, and then the other one is analog PET-CT. So what is the difference between the analog and digital? So you can see the photo on here. So for this one, actually is for digital, and this is analog. So you can see the digital, the image will be more clearer. So the radiologists, after they do the scanning, they can more easy to see like which one where is the exactly active tumor. And also, we are the first hospital in Malaysia to have 5 units of the robotic surgical system, which is a robotic machine. And also, we have 30 of the robotic trained surgeon, definitely including the Dr. Christopher Lee. And also, up to that, we actually done more than 3,000 cases for the robotic surgery. Okay, and this is the discipline for all those 5 the robotic system, like including the urology, gynecology, colorectal, and so on. Okay, so in Sunway, we do have 2 units of the Da Vinci, which this one I think later Dr. Christopher will further explain what is this machine about lah. Okay. And also we have 1 Mako and 1 Rosa machine. So these 2 are basically focusing on the knee replacement, joint replacement machine. And also we have the Mazo, which we recently invest on October of last year. So this one will be more focusing on the spine surgery. Okay. And this is our doctors for different types of the robotic machine. Okay. So you can see Dr. Christopher is right here. And this is our pediatrics doctors. So we actually have 24 subspecialized and 44 pediatricians in Sunway. So you can see that from head to toe kind of the specialties for pediatrician we actually have that. So you can say that like if you cannot find any specialist for pediatrician, pediatric specialist in Sunway, so I think in other hospital you also can find already lah. So this is the list for our subspecialties for pediatrics, like including the dermatology, ENT, nephrology, oncology, and so on lah. So here's our recent success story. So in last year, we actually is the first hospital, first Malaysia private hospital to get 3 accreditation, including the JCI, ACHS, and ASQH. Okay, and also we already successfully done more than 1,000 of robotic hip and knee surgery. And also one of our Dr. Chua, by end of last year, he alone already done 1,000 cases using the robotic surgery, using this one. Okay. And also, as I mentioned just now, we are the first private hospital in Malaysia to have the children emergency. Okay. And also, one of our doctors from pediatrics ICU, Dr. Anis, she's quite aggressively to organize some of the event to the nurses and doctors to help them like attend the course, to take care of the children, all this lah. And also I think by this month, early of this month, we actually awarded by the Newsfeed, which is the world best hospital in this year lah. So actually it's our second year to get this world best hospital. And by last year, we actually is ranking in 233. Then this year, we increased until 193 lah. So by hopefully next year, we can keep on increasing. Because this one actually is a global one lah. And also, this is some of our awards in the Asia. Okay. And this is our room for the VVIP. And this is for the like premium single room, 2-bedder room, all those lah. So in some way, all of our room, right, we actually apply with this memory scan. So this one memory scan, actually it can very accurate to detect any abnormal for the patient. So for example, like the patient, maybe they have a sudden blood loss or what, or abnormal of the BP, all this. So the memory scan, it will directly send the signal to the nurse counter. So nurse no need to like one-to-one to check like which patient is abnormal or this. You can directly go to the bed to attend the patient. Okay? And this is our room rate in some way. So basically you can search the room rate in our website also lah. Okay? So here's some of our facilities. Like we have a family mart, 7-Eleven, all those inside the hospital. So when you go to hospital, maybe do the health screening or what, so no need to worry, right? Don't have anything to eat or what. Okay. So this is some of our ongoing package. So some actually is only applicable for this Malaysia. Okay. Like actually we have the annual health screening package. So inside the goodies, inside actually we do have a hard copy lah, so you all can have a look later. So for this selected health screening package, we do actually offer 30% discount for East Malaysia clients lah. So you can choose like which package you want to choose. And after that, you all can look for me or Amber for further appointment. Because if you walk into KL somewhere directly for the health screening, then you will only get the original price. Okay. And also, in conjunction for this 30% discount, right, we actually have this one so-called giveaway lucky draw session. So it's a winning prize. The grand prize here is 888 ringgit. So you just subscribe any of the health screening package, so you get a chance to win the lucky draw lah. Okay. And also, this is the promotion price for our endoscope package. In case some of them I think that I already go to KL to do the health screening, then why not I do the colonoscopy, endoscopy at once. So here is the promotion right now. And also, we have the free second opinion consultation for the cancer patient also lah. And this one is also applicable to East Malaysia client only. So if let's say you have any clients or family members or friends that actually like maybe recently diagnosed with cancer, so maybe they want to seek for a second opinion before go for the treatment. So you all can send us the report. So we will send the report to either Dr. Ivan or Dr. Nick for their review. So once they review, they will feel that okay, I can meet this patient. So will be depends on patient. They want to travel over to KL to physically meet doctor for further consultation, or they can do the daily consultation via the video call. So this the first consultation for this one will be free of charge. We don't charge any single cents for this one. Okay. And also you might think that me and Amber is over here, but then we don't have any physical hospital. So what actually both of us are doing here? So actually we are more to like a patient assistance center over here lah. Okay, like we can assist you all to make the appointment, the doctor's appointment, and also like maybe some of the clients they might thinking that which specialist or which doctor I should look for. Yeah, so we also can recommend this lah. And also like for inpatient, if there's any admission, so we can assist to arrange the fruit basket also. And also the accommodation recommendation also. And also the transportation from KL airport to hospital, or from hospital to KL airport. So this one we did not charge any single cents, it will be free of charge. So you just send us the itinerary, so we will help you all to arrange all this transportation. And also the meal voucher also lah. We will give you the meal voucher, so you can maybe save around one time of the meal from in KL. Okay. So this is our coaching office. Our office actually is located at Gala City, first floor. So anything you all can contact me or Amber. This is our contact number lah. You can scan here for the WhatsApp. Okay. Or maybe some of you might need our personal contact number or what. Then maybe you all can look for us lah. Okay. And this is our social media page. So feel free to like our social media. So we will post at any of the upcoming events or any ongoing events and activities lah. Like for today's the event letter also we will post in this Facebook lah. Okay. So I have a video for you all to have a look at. It's more to introduction about our Sunway also. Sorry, I think the sound is quite soft, so I just explain all from here lah. Okay. So just now you can see the one actually is our Tower D, the lobby, and then we have the Japanese translate for this lah. And this is the 28 Center of Excellence that I mentioned just now. So we have the Nuclear Medicine Center to explain, to consult, and assist the patient also. And this is our digital PET scan machine. And also we have the hematology service. which is more to like leukemia, patient. So this is the WC, which later Dr. Christopher will further explain what is this machine about. So this one is more to the hip and knee replacement machine, and this one also is the massage. And this is our another machine for the spine surgery. And this one is the format for those like rehab technology machine. And this one is some of our orthopedic departments and also the consultation suites. So this one actually is located at Tower D. And this one is our PITS A&E children emergency. Basically, this is the deal surrounding the Sunway Medical Centre. I think that's all from my part. So before I invite Dr. Christopher to have a talk today, let me have a very brief introduction about Dr. Christopher. So Dr. Christopher actually is a Sarawakian also. Previously she stayed in Beijing also. Okay, so Dr. Christopher Lee is our consultant of neurologist, endourologist and robotic surgeon in Sunway Medical Centre, Sunway City. And he is graduated from the UNIMAS and UKM. And he also in the fellowship in the Royal College of Physicians and Surgeons of Gastro, European Association of Urology, Urological Association of Asia, Malaysian Urological Association. And his clinical focus actually is in the general urology, urinary stone disease, urological infection, benign prostate disease, urological cancer including kidney, ureter, bladder, prostate, testis, and voiding dysfunction. So without any further delay, let me pass the floor to Dr. Christopher for the topic introduction.
Thank you, Sue. Good morning, everyone.
Good morning.
Thanks for spending your Saturday morning here with us. Pleasure to meet all of you. I'm Dr. Christopher Lee, as Sue has very kindly introduced. So I grew up here in Kuching my whole life. I studied in St. Thomas. Anyone from St. Thomas here? Two people. Terrible school, right? Our big rival St. Joseph. Anyone from St. Joseph here? Okay, good. Just kidding, just kidding. So yeah, I grew up in St. Thomas and then studied UNIMAS. So I only left at the age of 25 after I graduated. Unfortunately, I never worked here in Kuching, as Sarawak GH is one of the best public hospitals in Malaysia. The only better ones are HKL, so should be proud because GH is a very good hospital. But anyway, without wasting any more time, today I'll be talking about these three conditions: prostate cancer, kidney cancer, and BPH. Does anyone know what BPH stands for? KK maybe? Okay. So got one question you don't know lah. Alright. So this is a general overview of the beginning of my talk. I'll talk about the common symptoms and how the patient usually presents. The diagnostic pathways, meaning the types of investigations that we need to do to make a diagnosis, and the treatment options that are available today. Okay. So one of the common symptoms is called hematuria, which means blood in the urine. This blood could be visible, which means that the urine looks red like this, or it could be non-visible, meaning that the urine looks normal, but when you do a urine test at the lab, they tell you there's blood in the urine. Okay? It could also be divided into a painful or painless. When it's painless, that means that you just see blood, but you don't feel anything. And painful means you could have pain. But it could be pain when you pass urine, like a burning sensation. It could be pain in the lower part of your tummy. It could be pain in the back also. Okay? When it's painful, it's usually caused by infections or stones. So it's quite good to have pain. When it's painless, it's more dangerous because it's usually associated with some form of cancer. So as I mentioned, the pain could be in the loin. The loin refers to this area here, it's the side, okay, and that's the area of the kidneys. So pain in the loin is usually caused by stones, most commonly, followed by infection, and lastly cancer. Suprapubic pain is pain in the lower part of the tummy, where the bladder is, and pain there is usually caused by infection first, followed by stones, and again, lastly, cancer. And I have to emphasize again that most cancers are painless, so absence of pain does not mean it's a good sign. Okay, that could actually be a bad sign. Another common symptom is urinary symptoms. LUTS for short term, it refers to lower urinary tract symptoms. Okay, lower urinary tract is from your bladder to the urethra, and in men it includes the prostate as well. These symptoms are divided into obstructive type and irritative type. Obstructive meaning there's a blockage to the urine flow. Okay, so the patient could present with a poor urine stream. Okay, they might say that the urine is slower than usual. Intermittency means they pee for a while, then stops, and then they have to put a bit of force, and then it continues peeing again, and then stop again. Okay, so straining is one of those symptoms. They need to push it out; it doesn't flow naturally. Dribbling means there's at the end there's dripping of urine as the urine is almost finished. It doesn't stop immediately; it drips some more. And incomplete voiding means after they finish passing urine, they feel that the bladder is not completely empty. There's still some balance inside. Don't feel very satisfied. Okay, the other group of symptoms is irritative. They could present with a frequent need to pass urine, like every half an hour, every hour. So naturally, how long can a person hold urine? Usually? During puasa month, maybe a bit longer lah, because it's not drinking water, right? But usually, a few hours, right? 2 or 3 hours, maybe no problem. So when you need to go to the toilet every hour, that's a abnormal thing. Okay. So the urgency refers to a sudden and very urgent need to pass urine. Like you need to go, means you need to go. You cannot delay. Otherwise, you might actually pee in the pants or the skirt. Okay? Nocturia is the need to wake up at night to pass urine. Anybody here wakes up at night to pass urine? No? Everybody's normal. Very good. Okay. So if you need to wake up at night, even one time, that's considered not very normal. Okay. But there's multiple factors. If you drink too much, go for a party, drink a lot of alcohol, then of course you need to go. That's normal. Right? But if a person needs to go every night, even one time is considered not very normal. Okay. Incontinence is the worst. It means the leaking of urine in the clothes. Okay, so you're unable to hold the urine, either because it's too urgent, you cannot make it in time to toilet, or the muscle is too weak. When you cough, sneeze, or you carry something heavy, then the urine leaks out. Maybe you've heard of some people, usually older people, complain about this symptom. So most of these symptoms are related to BPH. I still don't know what BPH stands for, later I'll tell you. And could be related to prostate cancer as well, but quite rarely. Another symptom is an abdominal mass or swelling. So you may notice that, how come my tummy is one bulge here, right? This is very rare, and it only occurs when the tumor, the growth is very, very big. Okay? So there's a lot of space in our tummy. So when it grows very big, then only it's noticeable from the outside. Some people have very non-specific symptoms, like just loss of weight, loss of appetite. They don't know why, I'm eating, but I'm not putting on weight, I'm losing weight. Or they just don't feel like eating. Okay? So this is a very general symptom, and it could be due to any disease, and sadly it could be due to cancer as well. They may also have anemia, means the low hemoglobin count, feel very tired, okay? Because not only are they not eating enough, the cancer is taking all the nutrients from the food. And sometimes the patients actually don't have any symptoms at all. So why do they come? They just come for medical checkup, and you find something abnormal. So these people are lucky. They actually came for a medical checkup. If not, then they would not be diagnosed with a certain condition that might be dangerous. So one of the common diagnoses made from medical checkups is a high PSA. PSA stands for prostate-specific antigen. So it's a cancer marker for the prostate gland. Anything above 4 is considered abnormal and should be referred to a urologist for further checkup. Okay, so this is what it stands for: benign prostatic hyperplasia. So do you need to remember this? No need, just remember BPH. Okay, everybody outside just talks. Just say BPH also anyway. So what is this condition actually? On the left is a diagram of a normal anatomy. This is the bladder. Okay, it stores urine, and the prostate is just below the bladder, and it's not in the chest. Okay, whoever answered that, but it's okay. So when you pass urine, it goes through the urethra, this tube, okay? And the urethra passes through the prostate like a tunnel. In BPH, what happens is the prostate gets enlarged, and it compresses the urethra. So you can see here is very narrow compared to the normal. Thus, the urine has difficulty to pass out. It becomes slow, and maybe you cannot empty it out properly. Right? So this is a benign swelling. Benign means it's non-cancerous. It's non-cancerous, but it doesn't mean it's not dangerous. It usually occurs in men above the age of 50, and it causes the type of symptoms that I explained earlier on, the urinary symptoms. So it could cause further complications, bigger problems if it's left untreated. For example, it could lead to blood in the urine, because big glands tend to have more blood vessels and bleed more easily. It could cause infection, because when you're not able to empty the bladder, and your urine flow is slow, it's like longkang sumbat. So the water becomes stagnant, becomes smelly after a while. So the same thing, okay? The urine also can get infected, and that could lead to a lot of pain and very dangerous infection. It could also lead to stones, because when the urine stays in the bladder, small crystals could form, and the crystals can stick to each other and become bigger and bigger, and that's what forms stones. In the long run, if it's still untreated, it could lead to kidney failure. Because when there is a high pressure in your bladder, difficult to empty, this high pressure, the pressure gets transmitted up to the kidneys. Okay? And this pressure will damage the kidneys. Okay? It's like a Gen Z. So sorry if any Gen Z is here. They cannot work under pressure, you know, cannot perform. So if the kidney has pressure, then sorry, I quit. Right, so how do we diagnose BPH? This is a very simple test we have in most urology clinics. It's a simple machine, well actually it's not, it's a complicated machine, but it looks very simple. There's a funnel which leads to a device here. The patient just has to pee into the machine. Like men, you can do it standing. Ladies, you can sit on the chair. And it will come up with a reading like this. So this is a normal graph, okay, like a bell-shaped curve. In BPH, you get a very flat graph, which shows that the slow is very slow, right? And it could be up and down means the urine goes and then slow down and goes and slow down again. So that is not normal, and then we can tell that okay, there's something wrong with your urine flow. The other test is a scope. It's called cystoscopy. It allows direct visualization of the cause of the obstruction. So it most commonly is due to the prostate, but not necessarily. There could be narrowing in the urethra as well from a previous injury or infection. The scope goes in through the penis, all the way through the prostate and into the bladder. Okay? And when we see the prostate, we can tell the degree of obstruction. We can see whether it's a little bit swollen or very swollen, and the two sides could be completely collapsed, touching each other, so that is a complete blockage of flow. The other test is an ultrasound scan. This is the prostate here. This is a view from the front. Okay. This is the bladder. There's not much urine inside. This guy just went to the toilet. This is the prostate gland here. So by measuring that, you can estimate the size of the prostate. This is a side view. Okay. The bladder is on top, and this is the prostate. So by measuring the 3 dimensions, we can estimate the volume of the prostate. Can anyone guess what's the normal volume in terms of grams or ml? What is the normal size of the prostate? 1, 2, 500, 30. Oh, today someone got the answer correct. The first try, yesterday also they were very smart. The first answer was the correct answer. How did you know that?
He attended.
You go sit at the back. Okay, so correct, 30 grams. But I've had a lot of patients whose prostate is a lot smaller, just 20 or 20 plus, and they have symptoms. So the size does not completely correlate with the degree of symptoms. I've had some patients with bigger prostates, they say they have no symptoms as well. The biggest prostate I ever treated was 250 grams. And that's almost 9 times of the normal size. So treatment starts with medication first, right? We don't usually do surgery right away unless they come in a very late stage. Medications, there's 2 types. One relaxes the prostate gland. So for prostates that are not too huge, we try this medication first to relax the prostate. Prostate is 50% muscle and 50% gland. So by relaxing the muscles, maybe it could ease the urination. If the prostate is bigger, we start the second type of medication to reduce the size. But it cannot go back to normal size, it just reduces slightly so that its urination can improve. Okay? But these medications, the downside is that it's taken for life. Just like your diabetes, high blood pressure medication, you take it only to control the disease. There's no cure. And in men, prostate will continue to grow for the rest of their lives. It doesn't stop growing. It only stops growing when you go underground. Okay? So the next type of treatment is surgery. There's many types of surgery nowadays for prostate swelling. Minimally invasive includes a prostate stent, Rezum, which is water vapor therapy, microwave, TURP, and laser. Okay, I'll show you a slide on each of these after this. And for those very huge prostates, like the 250 gram one I told you, you have to do something a bit major, like open surgery or robotic prostatectomy. This is a picture of the prostatic stent. Again, the bladder is on top here somewhere. This is the prostate swelling. A stent is just like a straw, you know, but of course it's not a plastic straw. It's made of a very special metallic device which we put inside, and then when you release it, it expands. So it expands to keep the opening wide enough for the urine to flow normally. It's a very good device, but it has to be left inside permanently. It is suitable for older patients who are not fit for any other type of surgery. So this can be done under local anesthesia. They don't have to undergo general anesthesia. It can be done as a day case also. This is Resume. The name is Resume, but it's a water vapor therapy. It's delivered by inserting this into the urethra, okay, and you can see that it blows out hot water vapor or steam. How it's done is the steam is injected directly into the prostate, and at a temperature of 70 degrees, this water vapor kills the prostate cells. Okay, so after the prostate cells die, then the prostate will shrink slowly. But it takes some time, not immediate. It takes about 3 weeks to 3 months to actually shrink. Okay? It's suitable for prostates up to about 90 grams, and it preserves the sexual function of the patient. So if you do a traditional surgery, then you get some complications, which I'll tell you in the next slide. This is microwave therapy. It applies the same concept using heat to kill prostate cells. So it's delivered by this special catheter here. There's a balloon that expands the prostate and delivers the microwave heat. Okay. This is the same. It can be done as a day case also. It can be done for prostate up to about 80 grams. And similarly, it takes a few months for the prostate to shrink. Okay, so you have to tell the patient, after the treatment, don't expect that you're going to have immediately improved urine flow. It will take a long time. Okay? This also preserves sexual function. This is the traditional surgery done for prostate enlargement. It's called TURP, transurethral resection of prostate. So it involves putting a scope in under general anesthesia. Okay? And what we do is we use this device called a loop. It's very hot. When we activate it, it's very hot. Okay? It glows just like, Star Wars, the lightsaber. I don't have a video of it, but it's very nice. It glows and it cuts the prostate. So you cut chunks of it. It's like a changkol, you changkol, everything, and slowly remove the swollen part inside. And the end result is that there's a very wide channel, so the urine can flow smoothly again. This is very, very effective. It's been done for more than 40 years, and every urologist can do this procedure. But unfortunately, it can only be done for prostates less or around 100 grams. And patients will experience retrograde ejaculation after the surgery, which means that when they have sex, they can ejaculate, but the semen, the sperm, does not go out. It goes backwards into the bladder. Because you can see, the semen actually comes out from a hole somewhere around here, and now it's more easy to go back instead of go forward, right? So this is the sexual side effect that I talked about, which you can avoid with doing Resume or microwave. This is another form of treatment, similar to TURP as well. But instead of taking out chunks of flesh like TURP, okay, this is an analogy using an orange. Instead of scooping out pieces of the orange, it peels the orange from the orange skin from the inside. Okay, so what is left is only the orange skin, like this. So it's not removing the entire prostate, but rather just removing the inside of the prostate by scooping it out. So this can be done for any size, okay? Even for more than 100 grams, it can be done. But you still have the similar side effect, which is retrograde ejaculation. So for very, very huge glands, which you cannot treat with all the other methods, then you have to remove the prostate by doing a robotic prostatectomy. Okay? I'll talk more about the robotic surgery in one of the last slides later on. Save the best for last. So that's all about BPH. We're going to move on to the next topic, which is kidney cancer. Okay. Anyone has questions about BPH now, or should we leave it to the end? Okay, you might write down your questions if you have any. We'll talk about it later. So kidney cancer. Where are the kidneys?
Chest.
In the chest. It's actually somewhere near your ankle. Okay, so kidneys, as I mentioned, are here at the back. Okay, you have 2 kidneys. Can any human being have 3 kidneys?
Can.
Anyone say yes?
Transplant.
Transplant, very smart. No, humans cannot have 2 kidneys. I mean, 3 kidneys. Can humans have 1 kidney?
Yes.
Yes, sadly, but not because of transplant only. Some unfortunate people are born with one kidney. Okay, so please don't donate that one kidney. Okay, so what is the difference between a tumor and a cancer? Does anybody know? KK? No, no? I should stop bullying her. Who's Ryan? Ryan is equally smart. Oh, you can answer. Sit down. I done the talk yesterday. So, tumor is a growth, abnormal growth. Okay? And a cancer is a malignant tumor. So, tumors are divided into benign, which is non-cancerous, and malignant, which is cancerous. Okay? So, examples of benign tumors are oncocytoma, papillary adenoma, angiomyolipoma. They can be dangerous in their own way, but they won't kill like a cancer. Right? So the malignant, the cancerous types of tumor that arise in the kidney, there are generally two types, which is called renal cell carcinoma or RCC. This grows from the flesh of the kidney. Okay? The other type is urothelial carcinoma, which grows from the inner lining of the kidney, which is in contact with the urine. Okay? So RCC or renal cell carcinoma, the incidence is 33 per 100,000 people in Malaysia, and it's ranked as the 15th most common cancer. It's quite low down the list, right? And the incidence, the highest incidence is between ages of 50 to 70, but more and more nowadays I'm seeing patients come at age of 40 plus, having cancers, maybe related to our modern diet and all the chemicals that we consume. Majority occurs sporadically, so that means that it could happen to anyone. It doesn't mean that if your father or mother has it, then you might get it. That is true as well, but sporadically means that anyone can get this cancer without any known cause. Right? There are some risk factors. Of course, smoking, environmental exposure to some certain chemicals. If you're exposed to asbestos, leather tanners is very rare in Malaysia, nobody making leather. Obesity, of course, and sadly, those with end-stage kidney failure are also at higher risk, 2 to 3 times compared to the normal person to get the kidney cancer. Right? So sad. They already have kidney failure and then they get kidney cancer on top of that. Right? What is the most common symptom? The most common is no symptoms. Okay, so this is one of the very bad cancers. They don't give you any symptoms, no warning. Suddenly you find out, oh, already spread, going to die soon. So yes, that happens. It's very sad. Sometimes they can present with hematuria, blood in the urine. So these people are lucky because at least they come, they have something they go see a doctor, may be able to catch at an early stage. There are some systemic symptoms like anemia, fatigue, loss of weight, hypercalcemia, which means the calcium in the blood is higher. These are quite rare actually. And they can also get this paraneoplastic syndrome, which presents with totally different symptoms, nothing related to the kidney. Okay? All in all, these symptoms are very rare. Most of the patients have absolutely no symptoms. So how do they get detected? How do we find out? Health screening. Okay? Without health screening, we will miss a lot of these patients. And it's very sad when they come in late. So once we detect something abnormal, so when you go to health screening, what kind of tests do you do? Blood test, urine test. So sometimes through the blood test, the urine test, we detect traces of blood, the non-visible hematuria. Okay, so we have to do some further testing. If your package includes an ultrasound of the abdomen, then you can also find maybe a small lump in the kidney, which looks suspicious. So the next thing we do to confirm it is a CT scan. Okay, CT scan like this. Okay. So the CT scan is from the lower part of the chest down to the bladder, all the way down. And you can see that in the left kidney is not seen here. This is the right kidney. The normal part of the kidney is this, with a very nice, beautiful, sharp outline. Okay, very bright. You can see that there's something very abnormal happening here. Right? Everyone can see that? So that is a cancer. So when you see a CT scan that looks like cancer, 99% of the time it is a cancer. And it is it's not the benign type, it is a cancerous type. Okay, so CT scan is a very good way to diagnose kidney cancer. You don't need to do any biopsy. Right? It's not like breast, I'm sure you have clients with breast lump. They need to do a biopsy to confirm before they do any type of surgery, right? But for kidney cancer, there's no need for biopsy. Once it appears like a cancer on CT, 99% it's cancer. Okay. So the CT scan allows us to visualize the kidney tumor very accurately, the exact size, position, okay, how many tumors there are, and it's very important in planning the surgery. So then the surgeon will decide on whether to do it open means a big cut like this, or laparoscopic, meaning keyhole surgery. And then they can also decide whether they want to do radical, means remove the whole kidney, or partial, that means just cut out this part right here. Okay, about 1/3 or about half of the kidney. That means the patient can actually save, so the patient will have 1.5 kidneys. So that's beneficial, because in Malaysia, unfortunately, kidney failure is very, very common. Do you know how many patients are on the waiting list for kidney transplant? Have a guess? 100 patients. In Kuching alone, I think it will be about 5,000 patients. So in Malaysia, there's 30,000 patients waiting for kidney transplant. So everyone here, donate one. Okay. So the CT scan also helps us to stage cancer. Staging means you want to know whether the cancer is local or has it spread to somewhere else. Okay? So that when it's spread, then treatment will be very different. Okay, so when you talk about surgery, we call it a nephrectomy. Okay, nephrectomy means removal of the kidney. As I mentioned, you can do it open, laparoscopic, or robotic. So robotic is part of laparoscopic surgery. The only difference is the robot holds the instruments, which is completely controlled by the surgeon. Okay? In laparoscopic, the surgeon has to hold the instruments by himself or herself. Okay, this is radical or partial nephrectomy. And for complex surgeries, where the location of the size of the tumor is too big, then robotic surgery is recommended, okay, to perform a safer surgery. There are other options as well. Instead of removing the cancer, if it's a very small one, we can do something to destroy the cancer, such as cryoablation. They inject liquid nitrogen to freeze the cancer, and then cancer dies. Radio frequency is using radio waves to heat up the cancer to a very extreme high heat, and that also can kill the cancer. But it's only for tumors less than 3 cm. What happens if the cancer has already spread? Is there any chance for cure? No. Is there treatment? Yes, of course there's treatment. You can treat, you can prolong the patient's life, you can improve the patient's quality of life, but cannot cure the cancer. So sometimes, even if it's already spread, for example, to the lungs, okay, to the liver, or the bone, we still remove the kidney to give relief from the local symptoms such as pain or blood in the urine. They don't stop bleeding, so we have to remove the kidney so that they can stop bleeding and be relieved from the pain. But this is only suitable if the patient is fit for major surgery. There's other treatment, such as this targeted molecular therapy, a whole list of very high-fi, expensive drugs, which aims to control the cancer, to reduce the spreading of the cancer cells. Okay? But again, despite the advancement in medicine, there is still no cure, no complete cure for cancer. Okay, that's the end of kidney cancer. Next, I move to my favorite topic, prostate cancer. So the quiz just now was all about prostate cancer. You didn't include any kidney cancer. It's okay. Prostate cancer is the easiest topic, but it's the hardest topic because so much research is being done every single day. There are thousands of new publications in journals about prostate cancer every year compared to kidney cancer, because prostate cancer is much more common. Does anybody remember the incidence of kidney cancer just now? How many per 100,000? 33, very good. So somebody is wide awake, sitting in front. Top student, is it? In class? Alright, so guess what is the incidence of prostate cancer out of 100,000? Just now kidney was 33. Prostate cancer, have a guess. Sorry? 100 per 100,000. Okay, not high enough. Anyone else? No?
100,000.
90,000.
Oh, this is too much. Everybody will be lying dead by the side of the road. Unless they come and see me. Right? Okay, so it is 854. compared to earlier on, it's only 33. Right, so this is like, my mathematics is not very good. Maybe 20, 30 times more, okay, than kidney cancer. It's ranked number 3 in Malaysia in males. Okay, what is number 1? You have to know prudential agent. Breast is in women, so they are on a separate list. Lung, correct. Lung cancer is the number 1. It's the number 1 cancer and the number 1 cancer that kills. Okay, so it's very dangerous. And the second is colorectal, correct. Very good. So prostate is ranked number 3. It is very, very common. Okay, but slightly different to lung and colorectal cancer. It grows slowly, not like lung and colorectal. That one progresses very fast. So prostate cancer grows a little bit slower than the other 2 cancers. Okay. The peak incidence is 65 to 75. Okay. Yeah, most of my patients, they are around that age. Some get diagnosed even before age of 60. Okay, so you cannot say that, oh, I'm still young, I'm only 50 plus, I shouldn't get prostate cancer. It's not that way. Okay, but very sadly, about half of patients get detected at stage 4. What does stage 4 cancer mean? Anybody knows? Higher stage is better or lower better?
Lower.
Yeah, so there's stages 1, 2, 3, and 4. 4 is the last, so that means it must be the worst, right?
Yeah.
Stage 4 cancer is when the cancer already spreads, and that's the last stage. You cannot have anything higher. This is very bad news. So this is very bad news, right? Half of patients detected at stage 4. It's very sad. Why is that so? Anyone can guess? Why are half the patients coming only when they already spread? Yes, exactly. No symptoms. So sad. This cancer is so bad. No symptoms, right? No warning. Only about 21% get detected at an early stage. At an early stage, it's good because then you have so many treatment options. So the risk factors are primarily genetic. Okay, so if your family member, we call it first degree relative. So if your direct bloodline has prostate cancer or any other cancer, then you are at risk as well. If your cousin has cancer, then maybe not so strong risk, but if your grandfather, your father, or your brother has prostate cancer, then you are at risk as well. Okay. Smoking also increases the risk a bit, and also diet and obesity. So very sadly, there are no specific symptoms caused by prostate cancer, okay, in the early stages. But most men will have some urinary symptoms. Okay, why is that? Because the same age group that have prostate cancer are the same age group that have PPH. So if they are lucky, they will come to the clinic, say my urine flow is slow, I have to wake up 2 times at night. This is actually very good because if they didn't come for those symptoms, then we wouldn't be able to detect that they have prostate cancer. So PSA screening, prostate specific antigen, is a cancer marker for the prostate. That is the only chance you have at detecting prostate cancer early. So if you do, even without symptoms, if you go do a medical checkup and you have this PSA included in your package, then you will be able to detect early. If they have come at a very late stage, very advanced disease, they may have some hematuria, they may have lower limb swelling, the swelling of the legs due to the lymphatic blockage from the advanced cancer. Okay, so if it's very widespread, prostate cancer likes to go to the bone, so they can cause pathological fractures. Like, sometimes when you have a bad accident, of course you'll break some bones at the trauma. But if you fall down, you trip here, and you fall down, you think something should break? It shouldn't, right? You should just fall down, get a bruise. But if you have a very easy fracture, that would be a sign that you have cancer spread to the bones. So once your patient comes with a high PSA, we will subject them to this scan called MRI. An MRI prostate looks like this. All right. This is the prostate here. All right. The prostate should look white and gray like this because the tissue is not uniform. But you can see this dark part right here. You can see that this abnormal. This is prostate cancer. So the scan will give the radiologist will report by giving a score 1 to 5. If the cancer looks like it's 4 and 5, then there's a high percent chance that it is cancer. But we cannot, unlike the kidney cancer, we cannot take the scan as a diagnosis, as an absolute diagnosis. Okay? we have to proceed with biopsy. In the past, there was only a transrectal biopsy. This is traditional. Ultrasound put up the rectum, and then the needle goes through the machine, the ultrasound machine, and takes samples of the prostate. But unfortunately, MRI is the only scan that can see prostate cancer. The ultrasound cannot see anything. So what we used to do back in the day was we just randomly take samples, 6 on the left, 6 on the right. So if you get the cancer, you get. If you don't, if you miss it, then you miss it. The result comes out, no cancer, and everybody happy. But actually the patient has cancer, right? So that's very random, not very reliable, right? So now we have new technology for the past 2020, about 6 years, 5 to 6 years. Okay, this technology is in Malaysia. I'm very fortunate because this special machine called the fusion biopsy, my hospital in University Putra Malaysia, UPM, was the first hospital to buy this machine. So I was lucky because I was the first Malaysian urologist to use this fusion biopsy. This is a much more advanced machine. It allows us to use the MRI pictures from just now and fuse it with the real-time ultrasound images when we're scanning the prostate. So by combining these two technologies, we're able to find the location of the cancer. You can see this yellow dot here. That is the location of the cancer. So once we're able to see that, during the biopsy, we can target that very accurately. So there's no longer missing or just taking by chance. Okay? This is done, the biopsy is done through a transperineal approach, means the puncture actually goes to the skin, which is clean, not through the rectum, where it's very dirty, has feces. It can be done under general anesthesia, spinal, or even local anesthesia. It combines the advantage of MRI, the accuracy of MRI, and the flexibility of ultrasound. Because ultrasound, the machine is just here. Has anyone done an MRI before? Here? MRI is very torturing. Okay? It's a huge machine, a small little tunnel. Patients go into that tunnel. It's very, very narrow. So people with claustrophobia have to be sedated. And the machine is very loud. So they give you headphones to listen to the radio, otherwise you cannot tahan. It's tick, 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 very loud. And it takes 45 minutes. You have to lie there, very loud sound, claustrophobic, 45 minutes to do. So obviously when by doing MRI, you cannot do a biopsy at the same time. That's why this fusion technology was created. Okay, you can just use ultrasound and fuse the MRI images. So it allows more accurate targeting of the abnormal lesions and is much less likely to miss the significant prostate cancer. So this is something I'm very passionate about, and because I was the first person in Malaysia to do it, I've collected a number of cases, so much so that they invited me to share my experience in Southeast Asia. So I've gone to Hanoi in 2023 to teach the Vietnamese. This is the biggest hospital in Vietnam, in Hanoi. It's called the 101 Military Hospital. It's got like maybe 1,500 beds, right? So I went there, I was very lucky. I showed them how to use the machine, how to do the fusion biopsy. And last year I went to Manila, Philippines, to teach them also how to do it. They already were doing the biopsy, but they wanted to learn how to do it under local anesthesia, because previously everybody just has to use a general anesthesia. Local anesthesia techniques are a bit more difficult. So I went there to show them how I did using my own technique. Okay, so once you do the biopsy, the report will come back whether you have cancer or no cancer. So if you have cancer, then the next thing to do is staging. Staging means you need to find out whether the cancer has already spread or not, or is still localized to the prostate. Traditionally, we used to do a bone scan, like in this picture. Okay, so all these black dots are cancer. Can you see that? It's everywhere. This unfortunate patient has cancer spread everywhere in the bones. Okay, then you need to do another CT scan to see whether it's spread to the lung, liver, or kidneys. But now we have a more advanced scan called the PSMA PET scan. This is not a regular PET scan that you have. I think we have PET scans in Sarawak, but until now we don't have a PSMA PET scan. This is a special one for the prostate. Okay, so in the PSMA PET, you can see this. And when it glows like this, then this is bad news. This is cancer. So once you diagnose and you stage the cancer, then you can offer the best treatment for the patient's particular stage of disease. When they're diagnosed very early, cancer is very small, not aggressive, has not spread, you can actually offer active surveillance. This active surveillance is doing a lot of things but doing nothing at the same time. Okay, you're not treating, you don't go for surgery, you don't go for any active treatment, but you follow up the patient very closely. See them every 3 months, check the PSA, do examination to see. The purpose of this is to hold on to the treatment, okay, because treatment for prostate cancer is very big, has a lot of impact. So you let them enjoy their life first with no complications, no side effects, until the cancer becomes a bit more dangerous, then you treat them at that time. Okay. So if they want treatment and the disease has not spread, then you can offer them this radical prostatectomy. Prostate gland may be very small, but the surgery to remove the prostate gland is very difficult because it's very deep inside. Okay, so you have to go through a lot of normal things just to reach the prostate. And then to remove the prostate, it could be quite damaging as well to the other structures. So again, the options are open. Okay, an incision like this or like this, or it could be laparoscopic keyhole surgery. But now the gold standard is robotic. Okay? Robotic surgery is most useful for prostate cancer because, as I mentioned, the prostate is very deep, very inside the body, very low in the pelvis, very difficult to reach. Okay? So robotic surgery offers us very good access to the prostate. So it's the most preferred technique for prostate cancer surgery now. It's called the gold standard. It has revolutionized the safety and outcomes in prostate cancer surgery. Okay, so for difficult surgeries, you need better tools. Okay, and the best tool is using robotic right now. But the downside is you need to be specially trained and certified as a robotic surgeon. Okay, otherwise you will not be allowed to use this game console here. So it looks like a giant game console. The head goes in here. Okay, so I have to put my head there. There's some microphones for me to listen to the staff talking to me. And in that, there is the 3D view of the inside. Because we put a camera into the patient's body, and we get a 3D view. Anyone watch an IMAX movie before? Yeah? Very nice, right? You can see things flying. So nothing flying inside the body, but you can see 3D. So you know where you are, you can see left, you can see right. It's very clear. Right? So these little things here are the controls. Okay? It's something like a joystick to move the robot. And there's a lot of pedals down here to do different functions. Okay, move the camera, cut this and cut that. Okay? So all 4 limbs, 2 hands, 2 legs, are all involved in the surgery. So you have to be specifically trained for that. This is a real patient. Okay, it's patient's all covered up to maintain sterility. The patient's head is here. Okay, and the head is tilted. The head is very low. And the feet are very high in the sky. This is the robot. Okay, it's called the Da Vinci Xi. There's 4 arms with holding 4 separate instruments. One is a camera, the other 3 are instruments. So humans have only 2 hands, right? But with the robot, the surgeon can control 3 hands. It's very nice. So you can switch with these pedals here. Okay? It's very useful. So you have an additional 1 hand to assist yourself in surgery. So the advantages are you get a better magnified view, and it's a 3D laparoscopic view. Okay, so very, very clear. You can go right up to the prostate and it will still be clear. There's more precise instrument movements. In laparoscopic surgery, when the surgeon has to hold the instruments by themselves, sometimes you're tired, your hands shake, so the instruments will shake. And do you want the instrument to shake if you're having surgery? No, right? So with the robotic system, even if you have tremors, they will be eliminated. Okay? The instruments will still be steady. So it improves the surgeon's focus and reduces fatigue. Okay? So if you do a 6-hour surgery, it's no problem. You don't feel very tired because you get to sit down comfortably, okay, and you can rest the elbows here on this bar, and then your hands just on the instruments. There's less bleeding, okay, because the surgery is more delicate, safer, and there's less pain as well, because for robotic surgery, there's only 6 holes across the abdomen. Each hole is about 1 centimeter only, okay, so there's only 6 holes. Less pain means shorter hospital stay. Okay, so if you can recover quickly from surgery, then obviously you don't have to stay in the hospital for a long time. So that's better, right? Nobody wants to stay for 1 week in the hospital. And not only that, you can return faster to your normal activities. So you will be discharged on the 3rd day, surgery on the 1st day, 2nd day, get up from the bed, start walking around, take something, take some food, go to the toilet, get back to normal. On the third day, you can be discharged. Okay? And when you get home also, you can do your normal things. Walk around, go upstairs, do some light exercise, even drive, no problem. Compared to those olden days where you have to do open surgery, 1 week in hospital, go home also have to rest another 1 week. It's very, very painful. The other option besides surgery is radiotherapy. Okay, so if you can choose either surgery to remove the prostate or radiotherapy. I'm sure most of you have heard about radiotherapy, right? Shine a radioactive beams into the body to kill the cancer. So here the cancer is not removed, they just use radiotherapy to kill the cancer. And there's a few new techniques using cryotherapy, like the kidney, using extreme cold to kill the cancer cells. Microwave ablation uses extreme heat to kill. And there's also this HIFU, ultrasound, which also generates a lot of heat to kill. So instead of removing the prostate, removing the cancer, they just kill the cancer. Hopefully it just dies and doesn't come back. One of the new technologies is irreversible electroporation. Okay, so this does not use cold, it does not use heat. It uses electrical waves to damage the cells, and the cells cannot recover. So they focus on the prostate cancer cells. And this is very new, very, very expensive technology. I'm going to Madrid next week to observe a workshop about this, and hopefully I like it, and then Sunway might consider buying this machine. It's very expensive, about 5 million. So it's, well, I don't know, maybe if I can convince Sunway to buy it, then we'll have that. So for disease that is already spread, it's very sad, no chance for cure, but there's so many types of treatment, okay? So many types. As you go down the list, it gets more and more expensive, okay? So all patients will have hormone therapy, we call it androgen deprivation therapy, ADT. You don't need to know all this. It's just manipulates the hormone, lowers the testosterone so that the prostate cancer sort of slows down. Okay? Chemotherapy is for the very advanced cases like the bone scan just now where the cancer is everywhere. Okay, so chemotherapy is suitable for those patients. And new medication called AR inhibitors also act on the hormonal pathway, and these are very, very expensive. The original drugs will cost you somewhere between 6,000 to 8,000 every month. So every month until the patient dies from the cancer. Okay. Sometimes you can give radiotherapy also, more to control the cancer, the local cancer, plus the hormone therapy. Okay, that's my last slide. This is my contact details. So if you have any questions, if you have any patients who you think might be having these problems, please feel free to email to me. You can also WhatsApp. You can call this WhatsApp number during the daytime. It's my office handphone. If you send at night, you don't expect me to reply. But you can send WhatsApp or you can call during the daytime as well. So if it's from any of you with a question, then I will answer it. If it's just to get an appointment, then my nurse will schedule it for you. Okay? Alright, Q&A time. Any questions? Yes?
Doctor, I have 2 questions.
Okay.
The first one is related to the BPH.
Yeah.
Do you have any experience?
Yeah, my first question is related to BPH. So do you have any client that done the stent into the urethra using Prudential medical card?
Haven't had any patients doing the stent for quite some time actually, because this doesn't cure the problem. It just sort of allows patients to tahan only because it just holds the urethra open. There could be some complications. The stent, if it moves, then it won't be effective anymore, and it could get infected. Patients sometimes have blood in the urine. So because of these few things, they prefer to have something more definite, like laser surgery or the other options. So it's definitely claimable. It can be fully claimed under insurance, but the option itself is something that most patients don't prefer. Like I said, it's suitable for those very old patients who cannot go for surgery. They're bedridden or something. They're very frail, so they want something very minimal risk. So prostate stent is suitable for those kind of patients.
So how long the stent need to be in their body? Is it permanently?
It's permanent.
Permanent.
Yeah, you leave it there forever. or until it starts to cause problems, then you have to replace it.
Okay, thank you, doctor. And my next question is there any possibilities that when a patient diagnosed malignant prostate cancer and after being removed, no need radiotherapy, no need chemotherapy, is it possible?
Yeah, generally after surgery, you don't need radiotherapy and chemotherapy. Sometimes, well, chemotherapy, I would say you never need it for those type of patients, because if they choose surgery, it means that the cancer is only localized to the prostate, it has not spread. So after removing, then they are cured. Whereas chemotherapy is suitable only for those very advanced where the cancer is already spread everywhere. Radiotherapy, sometimes you need it because after you do the surgery, if unfortunately the cancer was not removed completely, and then when the pathology report comes back, they say that, oh, it's an incomplete removal. Then it's very sad. Then you have to add on some radiotherapy to kill whatever is remaining. That's possible.
Yeah, so for this cancer patient as now, after being removed, right, will it affect the sexual function?
Oh, yes, unfortunately, most patients who go for surgery, and even some patients who go for radiotherapy, they have a very high chance of erectile dysfunction. Yeah, because the nerves that control erection are right beside the prostate, just outside of the prostate capsule. So for cancer surgery, sometimes we have to get a good margin. We have to remove a little bit more than necessary, because sometimes cancer can go beyond whatever the eyes can see. So if you just remove ngam, you might leave cancer behind, and then there's no point in the surgery in the end. You're still leaving something behind. So we take a little bit more than necessary in most cases. Only in exceptional cases where the cancer is confirmed only on one side, or maybe in the very center of the prostate, nowhere close to the capsule, then we can just cut ngam on the capsule and try to spare the nerves that control erection. But those are very special cases.
Okay, thank you.
Yeah, welcome. Somebody has a question back there?
Hi, doctor. I got a few questions.
Few questions.
Okay. I interested.
Good.
So we have knowledge to say to other people too. So because I heard you say these two was the whole session, general anesthesia and local anesthesia. May I know what is the difference? You can answer some of this.
Yeah, sure. I answer one by one, others I forget. So general means that the patient is put to sleep. Okay, the anesthetist will give some injection, patient will completely go to sleep. Then they have to put a tube in the throat for ventilation. So once the patient is sleeping and paralyzed, then they have to go on temporary life support to help them breathe. So that is called general anesthesia. So because it's so strong, the risk is high. Like patients who have heart disease, lung disease, then it's high risk to them. There's a 0.01 chance that you can die just from anesthesia alone. Before the surgeon walks into the room, already mati. It's very, very low risk, and we don't allow that to happen because we usually check the patients thoroughly first. Those who are fit, then you can go for general anesthesia. Whereas local anesthesia, you only inject the drugs at the area to numb the skin. And then when you poke or whatever, then there's no pain. So that's very safe. Anyone can do that.
So then, okay, they say so you have the active surveillance.
Yeah.
This one is for because the risk of the treatment or the surgery will affect them the whole life.
Yeah.
So the question is, how danger is danger that they have to go for the surgery already? What's the symptom that they I need to do now? I need to go see Dr. Christopher. How?
Okay, it's not based on symptoms. Like I said, most prostate cancer patients who come in the early stage, they have absolutely no symptoms. Okay? So active surveillance is something we decide after we do the entire investigation. PSA, the MRI, the biopsy. When the biopsy comes back, they will tell us not only confirm whether it is cancer or not cancer. When it's cancer, they will tell us the grade, okay, whether it's high grade or low grade. High grade meaning is very aggressive, low grade meaning is less aggressive. And then we will look at the biopsy. Okay, I took, for example, 30 samples, which is the common average number of samples I take. Okay? So about 30 samples. And if they say only one sample has cancer, so this is very mild. Only one cancer, one sample, and if it's a low grade, not very dangerous, then you can say, this patient is suitable for active surveillance because the cancer is very early. We detected it very early. It has not spread yet. So at this early stage, there's no risk of dying. Okay, it will not spread soon. Maybe patient can have another few years before it becomes dangerous. So that one is not the patient's decision. That one we have to monitor every 3 months, and then when we see signs that the cancer is progressing, then we tell the patient, okay, time is up. You cannot wait anymore. We have to treat now. Right? So nothing based on patient's symptoms.
So, as you say just now, that it will not spread. So, for the prostate, this cancer can be spread like breast cancer, also they can spread, right?
Yeah, every cancer. The problem with cancer is not the cancer itself. It kills because it spreads. When it spreads to the lungs fail. It spreads to the liver fails. The cancer itself rarely kills the patient, except for brain cancer, because the brain is very important, and it's put in the skull. So there's nowhere to grow. If it grows, it presses the brain, and then it becomes dangerous. So any other cancer does not kill by itself. It kills because it spreads to some vital organs, and then those organs shut down, and then it will die.
Thank you for the clarification.
Okay, I thought you said many. I thought you said many questions.
Many, but I forgot already.
Okay.
This one, later I ask you secretly.
Secretly, no sex question. I told them yesterday, because I'm a urologist, so when I talk about cancer, BPH, they listen. But in the end, the question is not related. They ask about sexual things, erectile dysfunction. Okay, I can answer. Yes.
Okay, doctor.
No such question.
Yeah, no such question. Just want to ask I'm in my 30s now, right? 30s, 40s, coming to 40. So anyway, what we can do to prevent it?
Which one, cancer or BPH?
BPH.
There's no real
Oh,
prevention.
prostate, yeah.
I mean, a
Prostate.
healthy lifestyle helps with patients who already have BPH, like avoid being obese, avoid drinking too much beverages that contain caffeine, like coffee, alcohol, and soft drinks.
Okay.
Because that makes you need to pass urine a lot, and then your symptoms become worse. So it's actually not preventing BPH from happening, but it's trying to manage the symptoms. Prevention, there are some supplements that is known to help some people. It may not be effective for everyone, but supplements like saw palmetto, pumpkin seed. If you walk into any pharmacy and tell the pharmacist, I want supplement for prostate, this is what they will recommend for you.
Okay.
So you can try that. It's not medication. You can take it. It's harmless, but it will not be 100% effective as a prevention.
Right, thank you.
Yes, top student.
Doctor, I have a question about kidney lah. It's not related to that one. Yeah. Is it when we drink a lot of water? How much is the normal amount of water? Because some people said you need to drink a lot of water.
Yeah.
Some people said you need just as much as you need only.
Yeah. So that depends on your size, the body weight. Okay. It's like if you see a polar bear and a cat, can they drink the same amount? Obviously no, right? So humans is by body weight. You need a 0.03 per kg per day. Okay, ml, sorry. So let's say if average size, we always take 70 kg. 70 times 0.03 is 2.1. So you need 2.1 liters. Right? So for a smaller person, maybe only 50 kg, you need 1.5 liters. Okay? So this is the minimum. It's not recommended. This is the minimum.
Maximum?
Nobody has studied the actual maximum. But if you drink too much, like 6-7 liters, it's not good also. Because together with the urine, you are losing the salts in your body. So if you lose too much salt, then that's not good also. Okay? It will be dangerous to your brain, to your heart. Because the heart and brain need the sodium, potassium to function properly.
Okay.
Any other questions?
Yes. Morning, doctor. My question is about the early detection.
Yeah.
Because just now you said sometimes people don't receive the symptoms But my question is, I'm not sure, but there are some clinics that have practiced that whenever people do health screening, they only do blood tests. And then through the blood test, there's the result readings from there, right? So is that enough for them to detect all this?
I would say it's enough if you are a young person, in your 30s, 40s, with no strong family history of cancer or serious disease. Probably enough just to do blood tests. The blood test usually includes urine tests. So if you're not doing urine tests, then maybe not enough. But when you get to the age of 40 plus, nearing 50, then you have to have a more comprehensive one, and definitely including the tumor markers. Okay. So for males, there are only 4. For the liver, for the colon, rectum, for the stomach and pancreas. And the last is for the prostate. So in ladies, they don't have the prostate one, they have the ovarian one. Okay, so also about 4 cancer markers. So you should include that. I would recommend nowadays, when you're above the age of 40, you should include the tumor markers in your blood test. Okay. And also ultrasound, that's important as well. Maybe you don't need to do ultrasound every single year, maybe every once in 2 years, because there are things that will not affect any results in the blood and the urine. So you can have a completely normal blood test, urine test, but you might have a tumor. You might have something else growing which is not cancer, but it could be dangerous if you let it continue growing. So without the routine ultrasound scan, you will not be able to detect those. Yeah. So if you find something on ultrasound, then we can do some action, do some further investigations. And for the kidney cancer, ultrasound is the only way that you can detect early. So without that, the urine looks normal, the blood test is normal, and you cannot see the kidney cancer. For prostate cancer, at least blood test you can detect.
But I also read through some posting on social media. They said that if, let's say, someone when they pee, the urine come out with foams, it's also a symptom of a kidney problem. Is it true?
Yeah, that's true, but it's not cancer. If you have a lot of foam in the urine, it means that you have protein in the urine. But a lot of patients come to me say they have a lot of foam in the urine, show me pictures and all, and yeah, it looks like it's slightly abnormal. But if you do urine test, there's actually no protein, so that's okay. So protein in the urine is a sign of early kidney disease. Not cancer, it's the kidney itself, the function is starting to be abnormal. So that can be treated as well, but not by a urologist, that's by the nephrologist.
My last question. I ever saw a report.
I think he's jealous because I call you top students.
No, I ever saw one of my clients. She actually have this medical record of hers stated that she has a renal stone. But she said that she don't need to do surgery for that. But I want to know for renal stone, right? How dangerous? I mean, like, at what level that they need to do surgery for that to remove the stone?
So stones in the kidneys, they could pose problems in different ways. Right? If they are small, they're not so dangerous, and as long as they sit in the kidney, they won't cause any pain, won't cause much harm. But the danger is that when the stones drop into the ureter, okay, so you have 2 kidneys, 2 ureters, which is a tube that brings the urine down from the kidney into the bladder. So this human ureter is very narrow. It's only about 3 mm. So when the stone is bigger than that, it will get stuck in the ureter. It will be very difficult to pass. And if it's very big, then you cannot pass. It just gets stuck there. It blocks the urine flow and then it'll damage the kidney. By the time, most patients, about 90% of patients will have very severe pain. And that's the most common cause of severe pain in the loin. Loin is at the side part of the back. Okay? So they will come very suddenly, very severe pain. You can be crying, vomiting. That's typically due to kidney stone. Okay? So that is dangerous, of course, because the urine flow is blocked. The other problem is that if you have a very huge stone in the kidney, you may or may not have pain, because if it doesn't block the urine flow, there will be no pain. Right? But those stones can continue to grow, get infected, and the patient can come with a very badly infected kidney. Sometimes if it's very bad, we cannot remove the stone, we remove the whole kidney as well. Welcome. Yes?
Last question. So if let's say in the family, the mother has a lung cancer history, then does the son in the late maybe 40s or 50, is the risk higher for him to get a prostate cancer because it's a different body part?
Yeah, lung cancer is not very closely related to prostate cancer, but we never exclude that as a risk because until now human knowledge is still expanding. So we don't have a specific gene yet to say that lung cancer is directly related to prostate cancer. But yeah, it's still considered a risk factor. We would be very cautious with these patients. So prostate cancer history is very, very strong risk to get prostate cancer. And the gene that I showed just now, the BRCA, we call it BRCA1 and BRCA2 gene, that is a link between a few cancers: breast, colon, pancreas, and prostate. So if anyone has either one of these cancers, and then we find families that, oh, brother had colon cancer, sister had breast cancer, and then this patient has now prostate cancer. So we'll offer them genetic testing for this gene. It's very expensive, but it's necessary because we want to protect the future generation. So they can tell them, oh, you need to check by 40 years old, you must do a screening, check for your cancer.
Okay, doctor, I have a question, doctor. This question is very important for me as a man. Okay?
Not sexual.
No. Very important for me as a man only, doctor. So I was wondering just now, doctor saying that people can live with one kidney, right?
Yeah.
Okay, but not more.
But women also have 2 kidneys, you know?
Yeah, 2 kidneys, but not more than 2, right?
Yeah.
But my question is, something I just curious about. Talking about the prostate, the testicle and everything, right? Any cases, doctor, ever experience a man living with one testicle or remove all the testicle after the operation? And any cases like that?
Yeah.
Can they live?
Yes, of course, no problem. But you know, you cannot do a testicle transplant like kidney. You cannot donate to your brother or anything.
A man can live with one testicle?
One testicle, no problem.
No testicle?
Cannot. You can live, but in cases where it's very unlucky, I had a patient last week had cancer in both sides, left and right testes. So we have no choice, remove both. But the patient needs to have a lifelong testosterone supplement. Yeah. So just replace testosterone and then they'll live like a normal person.
Any abnormal cases, men with 3 testicles?
I've never seen, but you know, social media, don't know whether it's true or not. You know, they put pictures and all these things.
Honestly,
you cannot trust 90% of things on social media.
After Dr. Shirin, I go and check. You know?
I see.
Important, right?
Yeah.
Okay.
So the 10% you can trust includes the summit page, right?
Good one.
Thank you, doctor.
Welcome. Okay, I think time for next agenda already, right?
Yeah. Anything else?
No more.
No more.
Thank you.
Alright, give a round of applause to Dr. Okay, thank you so much for the insightful information. I hope that it will help us to expand our knowledge and share it to our relatives, our friends, our family, and also our surrounding. Without further ado, I would like to invite Leader Adrian for a token of appreciation to Dr. Christopher.
Oh, okay.
Thank you.
Yeah.
Okay. So I don't have to wear tie to work, right?
No.
Okay.
Okay. 1, 2, 3. The other one. 1, 2, 3.
One from this side with the people.
Oh, okay.
Another one with the people.
I see.
Thank you. Yeah. Okay.
So you didn't know I'm Sarawakian, so you got
Yeah, I didn't know.
Okay, it's okay.
Yeah.
I don't have this at home.
Oh, okay. Keep frame at home. Do photo, come.
Can I be blocking people?
Bring the chair.
Yeah.
Everybody come in front, everybody come. Yeah.
Okay.
Okay.
Let's squeeze in. Okay, and tuck in your tummy.
Alright, everyone ready?
Okay, breathe in.
Everyone again. Count of 1, 2, 3. One more. 1, 2, 3. Everyone point to doctor. And
Okay.
1, 2, 3. Alright, thank you.
Alright.
Thank you.
Very nice. Alright. Extract the picture. Thank you very much. Oh. Very nice. Okay. Thank you.
It's okay.
Okay, so the next session, we're gonna pass it to our second speaker of the day. She is a unit manager too, and she is gonna talk about claim, prudential claim. She is also has one of her highest claim is also over 100K, and sorry, I sound very cranky and nervous. But actually, I'm not. It's just very cold here. Okay. So for this client, his claim was over 100K in the year of 2023 at the age of only 51 years old. So without further ado, I would like to welcome. Where is our leader? Leader Intan NG.
Okay, thank you to our MC and thank you to Dr. Christopher and the Sunway team. Okay, so today I just want to share a little bit about my claim experience. So why medical card is very important. Okay, actually a lot of time when the sickness diagnosed on the last stage, then the recovery is quite difficult, and then the chances to surviving rate is lower. So some of the things that can help us to recover faster, to get faster treatment, survival rate higher is having fastest medical treatment for the sickness or fastest diagnosis. So how we can do this? If let's say I give two scenario, for example, this person have insurance, this person don't have insurance. So the first thing when we want to go for check-up, when we are having some symptom, okay, and then we may think about money first. That is number one. Or if I go for check-up, how much will the bill cost? How much is the check-up bill? Especially like blood tests, when you check a lot of things, then you add this, add that, and then end up the medical check-up cost also higher. So it's good that when we have medical card. So some people may ask, is medical card important for me? How medical card can help me? And then how to use medical card. So this one is just a scenario, tidak berkaitan dengan yang hidup dan yang mati. Okay, just for illustration purpose. If let's say this person no medical card and this person has medical card, what is the difference? When something happen, this person may use his own money to pay all the medical bill. Okay, this person even though don't have any saving, but when diagnosed of critical illness, the medical card will cover all the bills. So who has the higher chances to recover and to survive? This one, right? Because they can get faster treatment. So this is the claim experience for myself, for my client. And this thing is called pacemaker, or in layman term we call it battery. When a person diagnosed heart attack, okay, and the heart is lemah, very weak, so this battery is needed to be put just underneath the skin on the left side is the heart. Small cut here and then put the battery in and then close. So when you touch the chest, you can feel this battery. And this one, the latest one, 2023, this is the price, 33,500. And this is the big type of. Okay. The next one, now the latest technology, pusat jantung. Even pusat jantung also using this. But the first question they ask my client, do you have 50,000 or not? If the client have money, have insurance, okay, they can do the operation at pusat jantung, and then they ask the agent to claim for this battery lah. But what about if the client don't have instant money, no cash at that moment? So the client have the option to be transferred to private hospital using medical card. Okay. My next example is, before this the battery is like that. The battery is outside the heart. But now, with the latest technology, the battery is here. So this one is more expensive. And no need to cut here. They insert from the thigh. Ada saluran darah besar here, they insert direct to the heart. Okay, and then the next one is, if let's say the client go for heart checkup and then do angiogram, you look at the percentage here. If 2 or more block, okay, 2 or more block, 70% and above, no need to cut battery, no need to do bypass, anything. You can straight away help the client to claim crisis shield under heart attack. Crisis shield, crisis defender, total multi crisis shield. As long as you see this one, got 70, 80. This got 2 clients. This one is 70, 80, 90. This one is 70, 80. All claim sum assured 50,000 heart attack. But the client as of now haven't go for any surgery yet because the suggested treatment by pusat jantung is bypass. So the client is not confident to do the bypass, but we claim the critical illness for the client. Okay, so this is bypass surgery, another client. This one is done at Cardiac Hospital in KL and is covered by Prudential. So Prudential good or not? Good. Yes. So this is the total bill. This one is only for the bypass. So the benefit now is by having medical card is like this. Go to pusat jantung. The doctor said the chance to survive, the risk is 50-50. So if doctor tell you 50-50, you want to do or not? Either hidup or mati, right? But because of having medical card, so the client went to get second opinion in KL. Then the cardiac doctor in cardiac hospital in KL told my client, oh, the risk is only 30%. So the chances of recovery is 70%. So my client go for it, come back sehat, survive. Now healthy, sehat lah. Okay. So this is the reason why you must have medical card. Okay, this one is another case. This one is recent case. This one, tibia fibula. So the name lah. Then this one also cost already 15,000. Only 3 holes on the knee. Okay, next one. This is also another case just recently. So you guess how much? How much is the cost at KPJ? Siapa boleh teka? The latest one. Maybe last time slip disc cost 16,000, 20,000. But this one just recently happened. This year. You guess how much in KPJ? 70. Oh, terlalu tinggi. Rendah sikit. 30. Yeah, siapa cakap 30 tadi? Breakfast from me, Okay, next week. Alright. 32,000, you see? The latest one, this one happened March, 4th of March this year. So now this is the cost. This is another reason why we must have medical card. So who don't have medical card here? Wow, mesti ada, okay? So this one is appendix. Appendix. Last time the appendix only cut here, luka besar. So you want to recover also take longer time. Now appendix is like this only, 1, 2, 3. This one happened to my nephew, so cost about 10,000. This one is 2016. Now I think more than that lah. Okay, Sometimes some people may ask, so if I buy insurance from this person, how much? Or if you want to become an agent, if I sell this, how much I can earn? Oh, sometimes client ask you, I buy from you, how much you earn? Kan? When you go out, maybe your client asks you lah, or your prospect asks you, I want to buy medical card, but I want to ask you how much I earn. How much you earn? Okay, reality in life is, ordinary people, extraordinary people, when they earn 20,000, the expenses 12,000, so they manage to save 8,000. So comfortable. If the salary is 10,000, the expenses 7, they manage to save 3,000. What about normal, survive and suffer? The suffer one is the salary 800, spend 1,000, negative. Another reality in life is, when right now, when you are making 1,000, how long do you need for you to generate 10,000 income? Okay, if now your income is 2,000, so you need 18 years to generate 10,000. This one is assuming that if the yearly increment is 10% every year. Then if let's say now your income is 4,000, so you need about 11 years to reach your 10,000. So why are we showing you this? Because either you want to buy medical card, or either you want to join us to become an agent. This is how much you can earn. If let's say a client purchase medical card from you, 1 month 200, you will get 50 ringgit commission. So 1 week you go and look for 2 clients. Okay, 1 month 8 clients. So this is 1 year. When you have this amount of client, you darab, then you calculate how much commission you will make. Later, the guest you see lah. If you really want to know how to earn money when you sell insurance, then you look for your introducer to explain about this. Kalau saya rajin if I can see 4 clients a week, how much I can make? You double. How about if I malas I only do half, how much I can make? Half. Very transparent. Okay? And for the benefits of becoming an agent, we have commission, we have renewal income, we have overriding. All this later on you can ask your introducer, how does the thing work and how much I can earn. So this one is a package for our new agent. Those who want to join us, we have this program to support the new agent. Okay, you can register to become an agent and you can enjoy all the benefit. Okay, this one also, later you ask your introducer about this. And if you do 2 cases since the day you join for 6 months, so you get 12 cases, then you get an iPad for free from Prudential. So that's all for my sharing. Either you want to buy medical card or you want to join as an agent, both have benefit. But first thing first, before you join as an agent, you must have your own medical card so that you know how to share to your clients. Right? Thank you.
Thank you once again, Media Ethan. So let's move on to the final session, because this final session is very interesting. We have a lucky draw, and we are so honored that Sunway is conducting this session for us. And there are 5 prizes to be won. If you are lucky enough, then you will win one of it. Okay. So how is the lucky draw is gonna be? There will be like a wheel, and then once you press on the spin button, then whoever punya name yang pop up is the person gonna win the one of the prize. And one of the special prize is very I also wish I can win that. Okay?
Gold.
Can you guess or not?
Gold.
Or just that day Sunway already gave us so much gold. Now it's different. So the first one is essence of chicken. So this one is 1% each. So let's start the Aki. Make sure that you all are registered in the QR, yeah? Oh no. Siapa tidak register dan so sad. So we have about 50 names here. Yeah, 50 names here. So siapa yang tidak register, bolehlah you pray that your name suddenly pop up here. Okay, let's start the first draw. Who's gonna get the essence chicken? Ryan! Unfortunately, this Valerie is not here, so we're gonna try again. Yeah, we redraw again. Mana tahu nak next kali. Okay, let's try again. We redraw. Wow! Congratulations to Team Tico. Okay, it's okay. More opportunity for us. Okay? Let's redraw again.
Redraw again. Yes, yeah.
Okay.
It's okay for those of you who are still here. We're gonna redraw again. Yay! Edgar! Not here. Sudah balik. Okay, let's try again. Yay! Who's gonna win the last round? Also not here. She's been waiting for this, yeah? She's been manifesting about it.
Another one.
Apa yang bawa bagi dia menang dulu. Weekend ini memang betul.
Okay, that is just the first two gifts. Can you guess what's the third and fourth gift? Okay, so the third and fourth gift is Electric Wireless Phone Charger.
Okay.
Okay, congratulations once again, dear son. Right. Okay, that was very unexpected, right? Everyone so jealous, huh? Chance,
Boleh pinjam nanti.
Okay, let's redraw for the second name of the same gift. Boleh bagi drum roll, let's give her.
Okay.
Okay, alam dong ya, alam dong. So the last gift.
Yes,
So what is the last gift? Honor watch.
Ben watch.
So for this last gift, let's see who's the lucky winner. Yes. Let's see who's the lucky winner for Okay, we would like to invite leader Adrian to
Simpan semua agensi kita.
Okay, one, two, three. Another one. One, two, three. Okay.
All the lucky draw. The picture come. All the lucky draw.
all the lucky draw.
Sampai lucky draw semua.
We would like to invite also the Sunway Medical team to be in the picture. Thank you once again, sir.
Nice, Pancho. Nice, Okay.
Okay. Wait, one, two, three. Okay.
Okay, thank you. Elsa, come. Yeah, okay.
Okay, 1, 2, 3. Okay.
Yeah, thank you.
Okay, congratulations. Okay, for those who won the lucky draw, don't forget to share. Alright? And that's all. We're coming to the end of our event. We have some light refreshment behind. Please stay and please get connected with each other, and you can ask for consultation from Dr. Christopher or further your question with him.
Okay.
Or just mingle around. Thank you so much once again, everyone. See you all in the next event.
Kita makan.